In UCD, the radiography programme is a 4-year honours BSc degree programme, and it has several different aspects to it. It has a technology aspect, a patient care aspect, and obviously how to position for radiographic examinations.
The diagnostic imaging section of the UCD School of Medicine and Medical Science is the National Diagnostic Radiography Training Centre, and as such we are the only university in the Republic of Ireland that offers a 4-year undergraduate degree course in diagnostic radiography.
It's one of those professions that is little known, to be honest, but it's 24 hours a day, 7 days a week in the hospital. There are radiographers working, doing x-rays, ultrasound, CT, MRI.
I had done a lot of research into the course before I applied. Even with that amount of research, it wasn't what I expected it to be. I always thought being a radiographer is just taking x-rays of bones and that was it. And I wasn't aware that the course covered all the other modalities like CT, MRI, other aspects like angiography.
To be sure of getting in, you need to have quite a good leaving cert. But almost more important than your leaving cert is an interest in radiography. So we strongly advise any candidate to the course to spend some time in an X-ray department, finding out what radiographers do.
The ideal traits of a radiographer is that first of all they need to be in some way technologically minded. They're going to be working with an awful lot of technology throughout their career.
It's very patient oriented, and the patient is the central focus. Without the patient, there is no profession.
I was quite excited to start in the first place. One of the key things for me was it was 10 years since I'd studied anything, so I was a little bit apprehensive about how I'd get on just academically.
I did physics in school, but if you hadn't done physics, it was taught to you from scratch. So you don't need to have any prior knowledge, just, good head on your shoulders and the willingness to learn.
We generally use first year as almost an introductory period to kind of show students what really is involved in the job and the role of a radiographer, because some may enter the degree course not having full or complete knowledge of exactly what's involved.
We teach you the theory of radiography here in UCD, but where you actually learn to do the job is out in the hospital. It's such an important element of your job that you spend a lot of the time during the 4 years out in hospital.
Not only have we had all the theory behind radiography and learning bones and anatomy, we've actually been in hospitals and dealt with patients, and I've actually taken x-rays as well.
We tended to combine clinical practice throughout each stage of the 4-year degree process. So in first year, students start off with 4 weeks. In second year, this moves up to actually double that, so 8 weeks in total in clinical. And then in third year and fourth year, students spend 12 weeks. So essentially, they got to 3 months or 1 full term in clinical placements.
When you get into third year, it's one of your final years. It's worth 50%, and fourth year is worth 50%. You need to start working on a thesis proposal, and then you'll be working on that then continuing on to fourth year.
In fourth year we have the Erasmus programme, which allows students to travel abroad. And currently we have students that are in Slovenia, in Ljubljana, we have students that are in Malta, and we have students in Norway, in Coimbra in Portugal.
At that point in their degree, they will also be thinking about career opportunities, and it will allow them an increased mobility where they can move around between European institutions and not just Irish clinical centres.
For those students who are thinking about radiography, one of the questions is, what will I do when I graduate? Well, the vast majority of students who do graduate do continue on to work as radiographers in the clinical environment.
The other opportunities would be to follow a research pathway. So a number of students realise throughout the programme, where they undertake a lot of research within the degree, that they want to further their research skills. So the other opportunity would be to undertake a Master's of Science degree or PhD qualification.
Every activity that we perform, either at undergraduate level, at graduate level, through the taught programmes, is all focused upon the patient. And obviously we wish to build on the skills for the radiographers to make them more specialised in specific areas, and ultimately it's just to deliver a better patient service and one that the student will enjoy while they study in UCD.